If an Ebola patient walked into our emergency room today, we are prepared. Our frontline staff have been trained as to ask the questions to identify such patients. These screening questions involve recent travel history to areas of the epidemic, that would be in West Africa, as well as contact with others who were known to have traveled to those areas. We have built in our electronic health system specific questions, and none of our patient access representatives will be able to register a patient without first asking these screening questions. If they get a positive answer to the screening questions, they'll be prompted to move forward with questions about symptoms, and should the patient be demonstrating a fever and associated symptoms, those patients will immediately be escorted to a secure area after putting on a respiratory mask to prevent the spread of this disease. We know that this is spread by fluids. They cannot travel long distances in the air, so our people have been trained to maintain a 3-foot distance from the patients whenever possible, and to get the patient back into an isolation room with negative airflow so they can be thoroughly evaluated. Should we discover that the patient, in fact, is a possible Ebola patient, we will treat the patient as if we know they have Ebola. We will not wait for confirmation from the blood test, because this can take anywhere from 24 to 48 hours for the test to become positive, and another 1 to 3 days before we get the results back. So to be on the safe side, those patients will be treated as infected until proven otherwise. The patient can be escorted then to a secure part of the hospital, which we've identified is very far off the beaten path. It's not possible for anyone to inadvertently wander into that area. Furthermore, we'll be posting security personnel at every possible entry point to the secure area so that no one could inadvertently wander into that area. Patients will be cared for by a very well-trained but small team that includes nurses, respiratory therapists. We'll set up a remote laboratory on site so that no body fluids will ever be transported out of the area. So once that patient is back and they are secure, you will not inadvertently wander into the Ebola area, and nothing from the Ebola area will wander out of that area. All of the waste, the used clothing, any equipment, any body fluids will all be securely stored in that area and will not be moved until an approved disposal method has been identified. As you know, also, the Centers for Disease Control will send in a team that will be on site within 4 hours of any identified patient. They will act as advisors and observers. They will make sure that all of our equipment meets the current standards of their recommendations, and that our procedures and processes are all there to ensure the lack of any possible transmission of this disease outside of the individual who brought it in.